Hi, I'm Dr. Ravi Sekhar Patnaik, Consultant Medical Oncologist, working at the Brunei Cancer Center, PGSC. November is a month where we celebrate as Movember. It is the art of growing your mustache in support of the male health issues, which includes prostate cancer, includes testicular cancer, and also we look at their mental health, male mental health. So I'll move forward how we are going to celebrate this whole month of November in support of men's health. So what is a prostate gland and what is basically a prostate cancer? We would be seeing that prostate is a small gland situated just below our urinary bladder, which is like a bag containing all the urine, and just in front of the rectum. So this gland is only seen in males. So virtually the cancer originates in this particular gland. Why is it important? Basically, if you look at prostate cancer accounts for 40 cases which we saw out of 448 male cancers in Brunei in the last year. So it accounts for almost like 9% of all the male cancers which happen in Brunei. It usually presents in advanced stage. The lifetime risk for prostate cancer for any Brunei male is 1 in 27, which is roughly, if you look at in Malaysia, it is 1 in 117. In Singapore, it's somewhere around 1 in 32, 33. So it's rare below 40 years, but increasingly common as we grow older, and we know that Brunei has slowly an aging population. And worldwide, it is one of the most common cancers in men. What are the symptoms? Basically, most of the time, people, the older people or the patients who are suffering from prostate cancer can have a difficulty in urinating, have a weak urine flow, they can have back pain, they can get a blood in their semen. They may also complain of erectile dysfunction, and they may have some pelvic discomfort, and this all happens in an older age population. So what do? Basically, we try to check their blood test, which is basically a PSA. Then the doctor would actually do a kind of a digital rectal examination to note the shape, size, and also the texture of the prostate gland. And then we ultimately do a battery of tests to figure it out whether you have a prostate cancer or not. Now, what are the risk factors for prostate cancer? Basically, it's more common in the black population, and the Asians have a lesser predilection for having a prostate cancer. Race is a big issue over here. As we grow old, we do get this prostate cancer, which is common. There is a strong family history. Almost like 36% of the people do have a strong family history. Either their father, brother, or grandfather would have had a prostate cancer. There is also something called as a BRCA mutation, which people think it is only related to breast and colon, but it is actually related BRCA2 to prostate cancer, which is quite common here. How we can prevent? We know that Brunei stands with obesity. We are number one in Southeast Asia. So we look at BMI, which is quite an important factor. Obesity is an important factor. Our westernized diet, which is rich in oil kind of food and a lot of red meat and substance, can actually be a cause for prostate cancer. Smoking, we know that 1 in 5 adult male in Brunei are active smokers, and smoking has a strong history with prostate cancer. Now, I will speak something about testicular cancer because a lot of people are not aware that testicular cancer is a cancer which happens to males. This happens in both the testes, which usually males have, and it is one of the most common cancer for male at the age from 15 to 40 years. It's the most common cancer. Roughly, we see something around 1.4% of all male cancers, we find that they have testicular cancer. So we usually in a year we see something around 6 to 7 cases of testicular cancer. As I told you, the most common age group is around 15 to 40, but we do also sometimes see older age group people, they do have testicular cancer. So this testicular cancer, why it is important? It's important because if we find it early, then the survival is almost like 99%. If we find it in a bit an advanced stage, with the proper treatment, which includes both chemotherapy, radiotherapy and surgery, we can touch something around 75%. So what are the symptoms which we are looking at testicular cancer? Basically, you will find a hard lump in testis, a different shape, whether it is a progressively increasing size of your testis. Sometimes people do complain of back pain, cough, they have a dragging sensation in the testis area. So how do you can check? You can check your both the testis if there is an irregular changes in your testis size. Is there any tenderness? If there is any difference mass over there. So if it is there, it is better to come to the hospital, get screened by an ultrasound, and the doctors can feel it, and then they can do a battery of blood test and biopsy if required, and then we follow up with few diagnostic tests and treatment. What are the risk factors for testicular cancer? Yes, testicular cancer doesn't have much on the food habits and other things, but it is mostly because of the undescended testis. That means the testis you cannot see normally, it is somewhere in the abdomen or below abdomen. So that's what we call as an undescended testis. So this is one of the main risk factors for having a testicular cancer. A strong family history here also amounts to that. That means if your brother or father had a testicular cancer, there is always a high risk of getting a testicular cancer. Abnormal testicular development, there are some people who are like what we called as some genetic disturbances like Klinefelter syndrome. All these people who are quite tall, they may have a different testicular shape and size. That can also amount to something what we called as a testicular cancer.
Hello, my name is Dr. Jamsari Khalid. I'm a radiation oncologist. Today I really want to talk to you about Movember. Yes, as you're fully aware, this is the month of November coming up. And as you may or may not know, that it is to create awareness in men's health, specifically talking about cancer of the prostate, testicular cancers, and potentially mental health. But I'm no psychologist, but we'll just concentrate purely on prostate and perhaps testicular cancer at present. Here in Pantai Jurudong Specialist Center, we have a radiation oncology unit plus a medical oncology unit. Our radiation basically will treat various different types of cancer. But today, we're just going to talk about what happens if you have or potentially have prostate problems. Most men as you get old will develop hesitancy, frequency of the urine, poor flow, and nocturia. What I mean by nocturia is that you would wake up a couple of times at night to pass urine. And majority of the time is because the prostate gets a bit big and it's very hard to pass urine fully. You would go to your own GP initially, would just complain and say, look doc, I really can't pass urine very well. So most often, PSA is not done. Prostate-specific antigen tests are not done unless you request for it. But recently, there's been an upsurge in demand of trying to find out, a bit more about men's health. And really, we want to create awareness into prostate health. So basically, if you do see a GP, do ask about a PSA blood test. And the GP can do it fairly quickly and you get results within 1 week. Very often the GP won't arrange any ultrasound at all. One would be referred to the main center in RIPAS hospitals to get an ultrasound scan of the prostate, review of the blood test, and if it's elevated, we would do something about it. Now, very often, elevated PSA could be due to inflammation, infection, and not necessarily cancer. And it's a simple blood test, so it's fairly straightforward. Very often, the doctors might offer what we call a DRE, or digital rectal examination. Fairly simple to do and not painful at all. It takes literally about 10 seconds or so. What I prefer, and what's the most important thing, is the new technology that we have is the MRI scan, which looked really into greater details of what's really happening in the prostate gland. With an MRI scan, you could detect any benign abnormalities, which is commonly the case. Cancer can be seen fairly well, but scoring of the cancer is dependent upon the expertise of the radiologist itself. Now, if you have a high PSA, a normal MRI, we would then offer you a biopsy. Now, in the old days, they tend to put a needle through the back passage. Nowadays, in the last few years, I've been able to offer a different type of biopsy, which is through the skin. And this would avoid any infections at all, in any way, shape, or form. In the old days, the rate of infection would be about 10-15%. Nowadays, we're looking at about less than 1%. Majority of the time, it is a 5 minutes procedure, fairly quick, but I don't do it under when you're awake. It's done when people are asleep. So it would be a quick general anesthetic, a quick biopsy. You'll be admitted in the morning and discharged on the very same day. Now, results are often available about a week later, and we would often discuss about the options then. Lots and lots of treatment for prostate cancer, but statistically, about 50% of the patients that we biopsy would have actual cancer, because majority of the other times, they don't really have cancers at all. So really, even if you have a high PSA, it is not the end of the world. It's really trying to exclude cancer as opposed to ignoring it altogether. Now, treatments are available, and we have state-of-the-art radiation here in PJSC. And the program has been started for over a year. It's nearly maturing to 2 years now, with over, I think, 150 cases done by the team. So I mentioned very briefly about radiotherapy that we have here in PJSC. Obviously, there are many, many options for even with those diagnosed with prostate cancer. The thing is, if you have a low volume, low risk disease, one of the things I would say is, one of the options we have is active surveillance. What it means is to actively survey the patient, do regular blood tests, and maybe a repeat biopsy on a yearly basis. Surgery can be done in RIPAS, and radiotherapy can be done here, and God forbid, if it's stage 4, chemotherapy is obviously another option to treat prostate cancer. So you'd have to look at it from the big picture. Prostate cancer diagnosis doesn't mean the end of the world. I've got patients, even stage 4 on diagnosis, living up to 20 years. So people tend to do very well because there are many multiple treatments for prostate cancer. So it shouldn't really be a big negative in people's mind. The key is that if we diagnose early enough, even on stage 3, it is curable. And statistically, in all our patients that we've done for the last 2 years, a lot of them, majority, are stage 1 and stage 2s. This is fantastic news, because if you catch them early enough, everything is curable.
Why is male cancer and male healthcare is so important? We have to understand that all over the world, females, they have a well woman clinic, or they have various screening programs. For males, there is no screening program as such, apart from other cancers like colon and other. So we do not, males do not go to the hospital feeling that it actually questions their manhood. So, but we have to understand that if a treatment is given or diagnosis has been done early, there is a 100% cure rate for an early stage disease. That is most important. So the take home message from my side is don't shy away, or don't feel that your manhood is at a question if you go if you have these kind of symptoms, or if you go for any screening for your cancer, which includes prostate or testicular and other cancers like colon, lung and other. The second is maintaining a very healthy lifestyle, which includes a exercise, maintaining your BMI, good BMI, and also avoiding very much the Westerner diet like the fast foods and other, and no smoking and alcohol, this which amounts to reduction of many of the cancers which are available, which are seen in most of the male cancers. So I would say that maintaining modifiable risk, if you maintain that proper BMI, avoiding alcohol and smoking from the start, could delay any chances of you getting these cancers. Least but not the last, I would say that this month, in support of all the male, I would advise you, please grow your mustache in any shape and size, and try to come out and show your bro feeling for everyone. Please grow mustache for Movember in support of males.
So the take-home message is, number one is early detection, because it is easy to do. You don't really have to fear the doctors. I think you have to come out in the open and just say, look, if you have a problem with passing urine, just go to the GP and just say, look, doc, could I have a simple prostate blood test? I think that's key in this matter. And anybody above the age of 50 to 55 and above could avail of this service. And because it's November and because it's Movember, ideally it would be nice to grow a beard and a mustache, or a mustache alone if you're daring enough. So I think I'll be doing the same come the next month. So come 1st November, I'll be shaving clean, and then we'll start to grow it and perhaps take a picture towards the end of the month and see how it develops. And I think it would be quite fun to do. It will be challenging. You will look weird, there's no doubt about it, but I think the message is to create awareness more than anything else. Thank you very much again for your time. If you have any questions, please do put your questions in Instagram. I'll do my best to answer the best I can.